Okay, good afternoon. I'm Christy Myers, and it's my pleasure to host the Menninger Clinic's second Facebook Live. Our topic today is addiction and why it doesn't have to be a death sentence. Now, I would like to introduce our experts to you. Vaughn Gilmore, who is Director of Addiction Services at the Menninger Clinic and leads a team of 15 chemical dependency counselors, and Gordon Meltzer, who began living with addiction at age 12, who overcame it at age 60, and today he's an addiction recovery specialist who is helping others. Welcome, and thank you for helping us shed light on this topic.
Thanks for having us.
Very, very important. Okay, so we're going to talk about the thing that's in the news, the elephant in the room. It's been filled with stories about the opioid epidemic, and the stats are shocking. 130 people died a day last year from opioid overdoses, and that's more people than died in car crashes. So, Ms. Gilmore, exactly what are opioids and why are they so addictive?
Sure. Opioids are a class of medications that include a range of substances. Prescription drugs that are used for pain, like hydrocodone, all the way to street drugs like heroin. And opioids act in multiple ways on the brain in a way that is highly addictive because of the sense of pleasure and reward that they provide and immediate relief.
So should people worry if your doctor says you've had surgery, I'm going to prescribe a drug that falls into this category of opioids? Should people say, no, I don't want it, or can they take it safely?
Sure. With any medication, if you're concerned, you should talk with your doctor. Talk about the risks and the benefits and why they're prescribing that medication. It doesn't take but so long to be prescribed an opioid or to be taking one for you to start to develop physical dependence, which then can move into addiction. So if you're worried about that, if you have risk factors for addiction, talk with your doctor about how to sort of reduce the risk, such as taking a lower dose opioid or only taking it for a short amount of time, or ask about other alternatives to opioids for pain relief.
Now, I've been told that you can actually become addicted to an opioid in 2 weeks when you have taken it as directed by your doctor. Is that true?
It just depends on the person in terms of their risk for addiction, like family history. It depends on the strength of the medication, how long they're taking it for, all of those different factors in terms of how quickly somebody can become addicted.
Now, that's just one of many drugs. Gordon, you said your journey of addiction began with a different drug. What was that?
That drug was alcohol. At age 12, I broke into my parents' liquor cabinet and I found something that not only relieved my anxiety but made me feel socially acceptable and fun and just was the answer to all my problems at age 12.
And it took you many years to overcome this addiction that began at 12. What were the sequence of events that caused this to last so long?
The sequence of events, essentially to boil it down, I never found a way to live successfully without the use of substances to kill pain and to solve my problems. The thing is that because addiction is progressive, over a period of a life, the amount of drugs and the type of drugs that I was using necessarily increased, and increased in consequences too, until I found recovery.
So had you taken opioids when you were in this lifestyle?
Oh yes. For many years I used hydrocodone and oxycodone and other prescribed and illegally obtained prescription medications. Opioids were really a very big part of my life. Later on, when I was about 56 years old, I started injecting heroin, and that seemed to provide the boost that the pills couldn't, but life spiraled out of control rapidly, and by age 60, I was out of options. I was at the end of the road, and I couldn't live with drugs or without them.
But you made that decision. What helped you turn that corner and change your life?
Desperation drove me to treatment, and the treatment that I found was here at the Menninger Clinic. And here is where I learned that there was a choice, that I didn't have to live that way anymore. And I think it's absolutely true, that's true for anybody who has an addiction, that we don't have to live that way anymore. There is a solution And the relief that's provided by a life of recovery is just indescribably wonderful.
And that is fabulous. Congratulations on your life-changing efforts. And of course, now you're working with other people to give them these same options. One of the things we talked about is if a person does become addicted to opioids, and perhaps they have no clue that they're going to be easily addicted, and the doctor says, enough, what's happening? Are they going and buying them elsewhere? And what are the additional dangers in trying to buy them on the street or from someone else?
Yeah. Well, you bring up a good point. Because of the nature of these substances, people often inadvertently get addicted to them, and I think that's an important point. Oftentimes, people are looking for physical relief, emotional relief, and they don't realize the risks. So they may be taking these medications as prescribed, or they may be using other substances for some type of relief from anxiety or trauma, and then addiction takes hold. So if somebody's worried about any of those things, we want them to ask for help. We're going to give some resources here during this show that they can call. They can talk with a loved one. They can talk with their treatment providers, talk with their physician. There's 1-800 numbers. There's treatment finders, and really get some help. Because like Gordon said, recovery is possible. There is hope. This is a recoverable disease, and so really the first step is asking somebody for help.
And we want to tell our Facebook friends, you can send your questions in so you can have the experts here give you some advice, guidance, just talk from their experiences. This is a wonderful opportunity for you to have your questions answered now. So please send in your questions and we'll take them during our show. Now, let's talk a little bit about some of the scary things that are showing up in these synthetic drugs, opioids. One of the things you told me yesterday was rat poison.
Yes. When we talk about synthetic drugs, we're talking about a new phenomenon that's here and with us now. In years gone by, people who were cut off from a prescription supply of opioids or tranquilizers or depressants like Xanax, but those are the primary categories of drugs, were able to buy those drugs on the street. And what they were buying was diverted pharmaceuticals that were identical to what could be dispensed by a licensed pharmacy. But today the story is different. Today, a person who goes to buy an OxyContin on the street, it will look and appear identical to the prescription OxyContin he's been taking for years. But it will have been made by a bootlegger, not a pharmacy, and can contain a wide variety of substances. It may contain some oxycodone. It will also contain fentanyl or carfentanil, heavy metals, halides, and rat poison and blood thinners. So it's not surprising that the overdose statistics are so high.
It makes sense. And you were also saying that in some cases these drugs can look like the drugs that people were taking by prescription, but they can be 50 times stronger than the drugs that they thought they were taking.
Sure, and that's where we're getting such high overdose rates from, is people think they're buying OxyContin or oxycodone, and actually it contains fentanyl, which is so much stronger, and then they're overdosing. Because they may have some tolerance, but they may not have enough tolerance, and that's where we get such high overdose rates.
So what would you recommend for a family member who is worried about a friend or another family member? How can they intervene? How should they intervene?
Sure. I mean, families can intervene a couple of different ways. One, if you're worried about a family member's just immediate safety in terms of opioid use, we would recommend having Narcan on hand in your home, which you can actually get here in Texas from the pharmacy. And there's actually also free local trainings on how to administer Narcan if you're interested in that. But more importantly, if you're worried about a family member's substance use, opioids, alcohol, any substance, not only thinking about their safety, but how to start approaching them in terms of expressing your concern. And what we recommend to our families is taking sort of a compassionate and collaborative approach. You want to set clear boundaries and expectations with your family member, but you also want to approach them with compassion. Addiction is a disease that brings about a lot of shame and secrecy. Usually people are already feeling really bad about what's going on, and if you approach them with a lot of sort of harshness and and criticism, it's really only going to make things worse, and they're not going to feel comfortable to come to you for help.
Could you talk me through how you might approach a family member? Say someone in your family you're worried about. Give me kind of a role model.
Sure. I would say, Christy, I'm worried about you. I'm worried. I've noticed that you're acting differently, and I'm wondering if there's anything I could help you with.
Now, if the family member says, no, I'm fine, which probably the first couple of times they're going to do, what's your backup response?
Sure. If you ever are worried about anything, I'm here, and I'm here to listen and without judgment.
Okay. And Gordon, any thoughts on that? What would have reached you? What you listen for?
I think what Vaughn said is really to the point and perfect. Confrontational approach is not helpful, contrary to popular opinion, because recovery is self-directed. That's a foundational premise. And encouraging someone to seek help without judgment is key. I never had that opportunity. So I think what we've learned in the years since I entered recovery are the things Vaughn is talking about now.
Well, thank you. And we want to talk about there's often a relationship between addiction and a mental health problem. How does that work?
Sure, there's actually a huge relationship, and it can go both ways. So sometimes what we see is substance use can lead to mental health problems like depression or anxiety. But what we mostly see, and what we typically see here at the Menninger Clinic, in about 70% of our patients actually have what we call a co-occurring disorder. And a co-occurring disorder is when somebody has both a mental health disorder like depression or anxiety that occurs at the same time as a substance use disorder or addictive behavior. And so the best way to treat those is actually treat them together. And the relationship is strong because if somebody's suffering from trauma or anxiety, we know that they're looking for relief. And so they may turn to substances as a way to cope with those symptoms, and that's why we want to treat it all together.
And we have some good questions now from our Facebook viewers. And please send more. We want to answer your questions while we're here. This is an excellent question. Do you need a prescription for Narcan, and how do you get one?
In the state of Texas, you do not need a prescription for Narcan. You can actually just get it at the pharmacy. There's also some local community organizations that will also give it out for free.
Yes, and it's a general prescription, and anyone can go to any pharmacy in Texas and ask for Narcan. They may not have it. My experience is you'll have to ask them to order it and be persistent if you need it because lives are at stake.
How is it administered?
It can be administered a couple of different ways, but most commonly it's done like nasally, and that's why there's also a lot of trainings. There's training videos online as well. The best way to think about Narcan in terms of having this on hand if you are worried about the safety of a loved one is the same way you would keep an EpiPen on hand, right? This is sort of a precautionary measure.
That family members can look for that are kind of clues something's going on.
Yeah, I mean, changes in personality, changes in sort of behavior, like how somebody is spending their time, the things that they're prioritizing, how they're spending their money, changes in terms of sleep patterns.
Isolation. These are disorders that thrive in the dark of isolation and die in the light of exposure, which is why recovery doesn't happen alone. It happens in relationship, either with a treatment professional or a recovery group.
That's good for families to watch for because they can get some clues then. Now,
well, I was just going to add one more thing. I think that's also really true with young people. I think we tend to normalize some of young people's substance use, like they're just being a teenager, they're just being a college student, I don't really need to be worried about that. But as a parent or a family member, if red flags are going off for you in terms of your young person's substance use, marijuana use, even alcohol use, all of these things can be really problematic for a young adult and an adolescent, and I caution parents not to write them off as they're just being young people.
And those are such difficult issues for parents and family because they want to help, but you hear about the tough love. Where is the balance between the tough love and the compassion?
Yeah, I mean, when it comes to young people, I think one of the best things parents can do is just talk with your teenager. Express your concerns, provide them education, make sure that you're well informed and they're well informed. And having those talks really actually can make a difference. The other things that make a difference in terms of reducing problematic substance use for young people is being involved and connected with healthy relationships and healthy activities. So instead of sort of being super strict and punitive, if they've just got them involved in other things that young people care about, that are important to them, if they have a close, healthy attachment relationship, those things are all protective against problematic substance use.
And we have another question from one of our Facebook friends. How should a family member who is close influence that person to actually get help after you bring it up and then you bring it up again? Do you just keep bringing it up, or what else can they do?
I think one thing that we should talk about that can provide some clarification on the concept of tough love is the issue of enabling. Enabling is when a person does something that another person can and should be doing for themselves. And removing enabling from a family situation can be done lovingly and kindly, but firmly, and that will help provide a sense of reality and perhaps the most essential motivation to change and deal with a problem, which is motivation.
Yes, what I would add to that is if someone is not experiencing any consequences of their substance use because they've been enabled, and usually when family members enable, they're not doing it on purpose, right? These things happen slowly over time. So they sort of start picking up the slack for things around the house or whatever it might be just over time. But by sort of putting natural consequences in place, like, no, I will no longer sort of do these things for you that support your substance use. That's not tough love, that's just love.
Yeah, can you walk me through what are some of the things, again, give me an imaginary conversation. If you are going to stop enabling me, tell me what you would tell me.
Like I will sort of stop giving you money, right? That's a big one. Like, I'm not going to give you cash, right? Or I won't give you rides anymore, right?
And I'm not going to call your work and tell them you're sick.
Okay. Okay. So it's up to you how to deal with these issues since you created the problem.
Right. Or I'm worried about your drinking, so I'm not going to drink with you anymore.
Okay.
That's a really
Not
easy one.
having alcohol in the house if you have a family member who has a problem.
Right, yes. Yeah, keeping your prescriptions locked up if you're worried about a family member taking them. But I think a big one that, especially when we think about alcohol, which is actually the substance we see the most here, people having a problem with, a really easy way that family members can be supportive is saying, I'm not going to drink alcohol with you anymore. I'm not going to stop you from drinking it, but I'm not going to drink around you and I'm not going to have it in our house.
Yeah. And that makes a lot of sense. It really does. If you are talking about what's in the news today, Canada and legalizing of marijuana, as an expert in this field, what are your thoughts? A whole country has said, okay, we're going to sell it to anybody for anything, anytime, recreational use. Is it really no longer dangerous? Or
Sure. So, marijuana, we know that marijuana is risky for a couple of populations, right? So for the average adult to smoke marijuana, once every 6 months, is that going to be super problematic? Probably not. The majority of adults can also drink alcohol without problem. But for certain populations, marijuana is particularly concerning. One of those is for young people, people sort of under the age of 25 or 26, because their brains are still developing. We know that marijuana can negatively impact the developing brain in terms of memory, learning, impulsivity, all of the things that young people right, are very important. And the other population that marijuana use is particularly concerning for is people with mental health issues. So individuals who might sort of want to use marijuana to cope, who have trauma or depression or anxiety or bipolar, it's actually particularly problematic for them. We know that regular marijuana use can worsen social anxiety, it can worsen suicidal ideation, it can exacerbate bipolar symptoms. So for this population, we really recommend that they avoid marijuana use.
So it really has a negative impact on a pre-existing mental health condition.
Correct.
We haven't heard much about that before.
Yeah, I really, as we move toward sort of additional access to marijuana, I think it's important for people to understand that there are risks. The same way for alcohol use, there are risks of drinking for certain people given their pre-existing health conditions.
And that's the genetics, that you do inherit a greater or less great risk of addiction. And that's hard for people to accept. People think if I drink in moderation, or if I take these opioids for 2 weeks, that I'm okay. But they may not have the same playing field.
Yeah, so what you're really talking about is sort of this inherited risk for addiction, and this can be true for marijuana, for alcohol, for prescription opioids, any other substances. And what the research really shows us is that about half of somebody's risk for developing an addiction is genetic, meaning it comes from their family history. So it tends to run in families biologically. And so, you may have two college students who both drink the same amount of alcohol in college, and one sort of stops drinking as they sort of, become a young adult and enter the workforce, and the other goes on to develop a severe alcohol problem. And the big difference there, if all the other environmental factors are the same, would be their genetics.
Now, we have some more questions out from our Facebook friends. What drugs being used by young people are more dangerous than their parents may realize? That's a good question.
Marijuana.
Marijuana, all right. Okay.
Yeah, I would say particularly, I think we even see that here sometimes where parents think that, marijuana use for adolescents and young adults is sort of a rite of passage, the same way alcohol use is. But again, for the developing brain, marijuana is particularly concerning. Do you have others that?
I'm thinking of the vape, what's going on with vaping these days. And I'm thinking about vape devices that a certain population of young people modify and drip things like cannabis oils directly on the heating elements, which I've read causes cancer-producing chemicals. There's a lot to do with vaping that is more harmful than we realize.
Yeah, and I also think alcohol. Again, I think we assume that alcohol use for young people is to be expected, but there's lots of research coming out on the health risks of binge drinking in terms of the developing brain as well. So it's not something that we want to just normalize for our young people.
And it was surprising. It was very few incidences of binge drinking had an impact on the brain. Can you tell us a little more about that?
I don't know offhand sort of the numbers or anything like that, but it doesn't take a lot of heavy alcohol use on a few occasions to sort of have those deficits. Again, learning, memory, impulsivity.
The kind of things you don't want is kids are talking about taking SATs and trying to get into college. Well, another question someone is saying since marijuana is being legalized, it appears to be safe, and it's been around for years. It's almost like a deception. Well, gee, Canada's legalized it, many states in the U.S., so it can't be that bad.
What Vaughn said is really right, and we need to be mindful of it. Putting youth out of the equation for a moment, for adults, the vast majority of healthy adults can use these substances recreationally, apparently. Can have a glass of champagne at a wedding, have a few drinks at supper, maybe smoke a joint from time to time with no ill effects. But that's not true for all of us.
Yeah, I would also say alcohol is legal, and alcohol actually poses a lot of health risks. We know that alcohol use is actually a controllable risk factor for things like Alzheimer's. So alcohol has a lot of health risks and is still legal. If done in moderation, those risks can be reduced, and the same thing can be true for marijuana. But the other thing to that question about, it's being legalized, so is it safe, comes down to potency. The marijuana that people are getting today, particularly out of states like that are, California, Colorado, Washington, where it's been legalized, is significantly stronger than the marijuana we saw people smoking in the 60s and 70s. And so potency is directly related to risk for psychosis. So really potent marijuana can actually sort of put people at risk for developing psychosis, which would be sort of hallucinations, paranoia, delusions, even when they're not smoking it anymore. So it's not 100% safe.
Oh, that is very disconcerting to put you at risk when you weren't already at risk?
Yes. Now, the risk is sort of twofold there. One is if you have the family history of some type of mood disorder or psychotic disorder, marijuana use at an early age can bring out that disorder, like schizophrenia or bipolar. But even if you don't have that family history and you are using incredibly potent marijuana, we do see people develop those symptoms.
That is heartbreaking. Well, I have one for you, Gordon. One of our Facebook friends said, is it too late to help an older adult who's been an abuser of drugs or alcohol?
No, absolutely not. I am living proof that these habits, although lifelong, can be changed and recovery is possible for any person still breathing.
And that's wonderful. That reminds people there is hope, and that's why we're here today, to remind them of that, to give them some options and get some help.
A lot of times, Christy, people with substance use disorders will hear a voice or a thought saying, well, this could work for him or it could work for her, but it won't work for me. I'm too old, I'm too young, I'm too this, I'm too that. Fact is, based on my experience, any person with a substance use disorder of any type can find recovery and find relief. Relief for themselves, relief for their families, and a way to live that makes them glad they woke up in the morning.
This is a question for both of you. What does good treatment look like?
Sure. Good treatment is evidence-based and usually should start with an assessment, right? Because everybody's substance use disorder looks different. You need an assessment by a qualified mental health professional that can evaluate not only someone's substance use, but any coexisting physical health issues, psychiatric issues, sort of any complications of their substance use. And then that assessment or evaluation should lead into treatment that's indicated sort of by the results of that assessment.
Right. These disorders express themselves in ways that make diagnosis, detection, and treatment difficult. So I can't agree with Vaughn more that an assessment by somebody who knows what they're doing, a clinician, is vital as a first step. What are we dealing with?
And
That's
then,
right.
And then it should lead into, so sort of what we know, evidence-based sort of successful addiction treatment includes working with multiple team members, like a psychiatrist, someone that can help work with the family and help the family understand what's going on, a qualified addiction professional that's licensed, preferably with a master's degree, and then it should also include recovery support. And this is where people like Gordon come in, recovery coaches, mutual support meetings, but there is a difference between addiction treatment and addiction support. So addiction treatment is provided by licensed mental health professionals, which is what we offer here at the Menninger Clinic. And then mutual support is support groups like AA, NA, Smart Recovery that supplement and really help that person maintain their recovery long term.
And we have a question from one of our Facebook friends, what resources are available for those ready to seek help. So I think one of the things we wanted to tell people is they can call here. There are people on staff here at the Menninger Clinic, and we'll give you that phone number at 713-275-5400. They can help direct you to the resources that you may need. Again, that's the Menninger Clinic, and they're ready to help direct people. 713-275-5400. There's another group called, it's an online group called SAMHSA.gov, and it's a government agency, and it stands for Substance Abuse and Mental Health Services Administration. That's pretty long, but I'll spell it. It's SAMSHA.gov, SAMSHA.gov. They can give you some options for your area, maybe some low-cost or no-cost places where you could get started and what kind of needs that you have. I understand that's a good place to go. So these are important places. Don't give up. Give them a phone call because they can direct you.
Yeah, absolutely. If you need help or you have a family member that needs help, call us. Or the SAMHSA website has a treatment finder on it, and it also has a lot of resources and information on addiction for family members, for individuals. If you want to better understand some of the things that we're talking about, there's a lot of free, great resources on that website.
And there's always something new out there. Once you understand something, then there's the not only the national cannabis discussion of the opioids, but now it's the CBD oil, which is approved in Texas for certain types of epilepsy, but it's being used in other ways that are not approved in Texas. And why is this becoming popular now, and does this have any long-term effects?
So I'll explain first maybe what CBD oil is. So cannabis has two main active ingredients, THC and CBD. THC is what we think of as the psychoactive part, the part that people want a lot of when they're trying to get high, because that's what sort of gives them that euphoric feel. And when we were talking earlier about high potency marijuana, we were talking about marijuana that has a really high THC count. And that's the part that sort of gives that euphoric feeling. CBD is the other main active ingredient in marijuana that actually is demonstrated to have some medicinal effects, specifically like with epilepsy. They're also trying it in sort of treatment for PTSD, for example. The problem that we're seeing is the amount of unregulated CBD. So a lot of times people think they're buying CBD off the internet, but it might still actually have THC in it, or it might have all kinds of other stuff in it. It may not really even be CBD oil. And so we caution people if that's something they're going to be using, especially somewhere here in Texas where it's not very regulated.
Okay. Another question from our Facebook friend. Do the medications that are available work in helping someone overcome an addiction? So how effective are those medications?
Yeah, so there's actually, we haven't talked about any of them, but there are actually a couple of medications specific for addiction treatment, like Suboxone or naltrexone, not to be confused with what we talked about earlier in terms of the Narcan, but these are medications that would be prescribed by a psychiatrist or an addiction medicine physician to help people with alcohol or opioid use disorders. And when those medications are used in conjunction with psychosocial treatment, like support groups and psychotherapy, they are demonstrated to improve someone's chances of recovery.
And the way that feels is that with those medications, a person who's in real trouble can be free enough from the cravings and the anxiety to actually engage in their own treatment and recovery. That's why they're a blessing.
The other thing that really is important here at the Menninger Clinic, because our patients have co-occurring disorders, is making sure that someone's psychiatric disorder is adequately treated with antidepressant medication or mood stabilizing medication or psychotherapy so that they can engage in addiction recovery. If we only treat someone's addiction with support groups and family therapy, then they're really not getting to any sort of other existing mental illness or psychiatric symptoms. So we have to really treat both, and oftentimes that includes medications as well.
And that seems to be one of the problems that people may not realize. If they don't feel well because they have a mental illness and it's undiagnosed, many people do try to self-medicate just to feel better and end up with two problems instead of one. Did that happen to you, Gordon?
On a daily basis.
On a daily basis.
Yes, Christy. Yes, and I think that I hear it from a lot of patients in the hospital that It provided these substances they were taking, self-medicating, provided them some relief, but they could never find a balance, and there were always consequences that outweighed the benefits.
Sure, yeah. So it makes a lot more sense to look for any underlying mental health problem, treat it, and maybe the addiction won't be as difficult to even overcome once the mental health problem is treated.
Well, there's a tricky thing there that I want to talk about for a minute, which is that addictive disorders perpetuate themselves by saying things to the sufferer like this: well, Gordon, you really just have depression. And when you get the right pills to solve your depression, you won't have an addiction anymore. But I think it's true that substance use disorders are a disorder separate from other mental health conditions that require treatment. They don't go away by themselves. Substance use disorders don't resolve because my mood gets better.
It's very insidious, isn't it? It's almost like you're working against yourself and your thought processes.
Well, yes, it can look like that, but it's so helpful when we realize that I have a disease that's
Right.
working against
Then
me
you know.
and talks to me in my own voice and tries to make me think it's hopeless, or alternatively, it's not really a problem. So having professional help from people who really can see reality helps a sufferer of substance use disorder see some reality and get some hope for change.
We have lots of good questions here. Here's another one from one of our Facebook viewers. What support does a person who's new in their recovery journey need, and do you have to leave behind friends?
I'll let you answer that one.
Okay. In the recovery literature, it suggests that we change our playmates, playgrounds, and playthings. And that can be very important early in recovery. If I've been maintaining an addictive lifestyle and I have people who have been enabling me and supporting me to do that, to find new people.
With what I saw and how they supported each other. That's National Alliance for Mental Illness. And families can feel very much alone too, even though they're not. So it's good for them to get support as well.
Yeah, absolutely. We would definitely recommend that whether or not your loved one is ready to get help, that you get help. And that can be through your own individual therapist. That can be through a support group like NAMI, through a support group like Al-Anon. Those resources exist for family members. And that way you are taking care of yourself so that you can support your loved one.
And as Vaughn said earlier, when you ask questions about how do we talk to our family members, those kind of support groups provide some of the answers and guidance for that.
True. And how do they respond in a way to help but not judge, and a way to enable you to make the good decisions and not enable you to continue. Those are very difficult issues. Is there anything else that you would like for people to know as we begin to close so that they can be encouraged that, one, get help? You can do this. It doesn't matter how old you are, and that the help works, and you will feel better. It's not going to be this horrible process, but it's actually a process that is enlightening.
Yeah, I mean, I would say that we know that there are millions of Americans living who have successfully resolved a significant problem with drugs and alcohol. So we know that recovery is possible, and that looks different for every individual. For some people that occurs through psychiatric treatment, for some people that occurs through family therapy, through Narcotics Anonymous, through AA, or just through making a lifestyle change. So it can look a lot of different ways. So what we would encourage is for people to sort of do some research, figure out what's out there, get some help, and figure out sort of how to resolve their issue.
And Gordon, anything that you would like to leave people with?
If you're suffering and struggling, ask for help. The resources are there. Don't suffer.
Don't suffer, as you suffered for too many years. Well, we thank both of you. Thank you, Vaughn Gilmore, the Director of Addiction Services at Menninger, for your insight. And thank you to Gordon Meltzer, a peer counselor at Menninger. You're kind enough to share your story of overcoming addiction. It's not easy, but it's appreciated. And we thank all of you for being with us today, joining us on our Menninger Clinic Facebook Live, and watch for our next Facebook Live in December.
Thank you, Christy.
Thanks, Christy.
My pleasure.